One of the commonest question I get is, can I have sex when I'm pregnant? A lot of people ask me that. A lot of people want to ask me but don't say that, and they kind of beat around the bush. So the answer is pretty simple. Yes, you can. You can have sex during pregnancy if your pregnancy is uncomplicated and if you feel up to it. Why not? Pregnancy is a natural process. It's, let's not make it complicated. Now, there are certain things though they change during pregnancy, right? Number one, our bodies change in pregnancy. As the pregnancy grows, our blood volume increases. So there's the extra blood flowing to certain organs in the body as the body is getting ready for this baby. So your breasts are more swollen, they are more sensitive. The nipples used to hurt in the first trimester, right? So that pain goes away, but they are more sensitive. Other parts of your body is also more sensitive. The vagina is more sensitive. There's a more blood supply going there. There's more wetness. There's more vaginal discharge coming out of it. So your response during pregnancy during sex is going to be different because of these bodily changes. Now, as the uterus grows in size, when you are laying down or in a missionary position, the uterus may fall onto the major blood vessels and cut off the blood supply, especially towards the third trimester or something, and you might feel a little bit dizzy. So you need to be mindful of the bodily changes and change your practice a little bit. The second thing which changes is also the desire. Now there are two things can happen. Number one, say if you were trying really hard to get pregnant and now you're pregnant, so the pressure is off, right? So you will enjoy sex more and you will not be as stressed out. The second thing is the hormonal changes will also make difference in the way you feel. Especially say, hey, in first trimester, you're nauseous, you're tired, you're exhausted. Sex may not be the first thing on your mind at that time. The second trimester, which is usually we call the golden trimester, when your hormones are at peak, you're feeling good, your nausea is gone, you're feeling the baby move, and you're actually enjoying this pregnancy. At that time, your desire might be heightened. You might actually want to have more sex, or you will enjoy sex more. Third trimester comes, it changes. You're tired, you're exhausted, your body is hurting, you're big, your body image has changed a little bit because of this growing pregnancy, and you may or may not want to have sex at that time. So depending upon where you are and where you feel, how you feel, I want you to feel comfortable that as long as the pregnancy is uncomplicated, yes, you can have sex till the end, till you go in labor or your water breaks. Now, a lot of people worry about, am I going to harm the baby if I have sex? Let me tell you that. Nature is amazing, right? Our body is amazing. Your baby is well protected inside you. The baby is in your belly. It's nothing in the vagina, right? So the baby is protected not only by your abdominal muscles, the uterus, which has got a really thick walls, and also the baby is in a sac with the amniotic fluid, which really cushions the baby. The cervix is closed, so the membranes or which carry the baby are completely closed off because of this closed cervix. And even with the deep penetration, it is not going to harm the baby. So you are not going to harm the baby by having sex. And remember, sex does not cause miscarriage. Never ever does. So don't worry about it. Don't get stressed out about that. If sex is something you want to have, go ahead, unless your OB has asked you to be on pelvic rest. The pelvic rest is done for reasons of complicated pregnancy. Say you have signs of preterm labor, you're having preterm contractions, your cervix is opening or is open, exposing the amniotic sac. you have placenta which is laying on the cervix, we call placenta previa. You have abruption, or there's a bleeding happening during pregnancy. Those are some of the reasons when your OB tells you no, you should not have sex, then you should really not have sex. Listen to your OBGYN at that time. Because what happens during sex, with the orgasm or even with the semen, which has got a prostaglandins in it, it stimulates the uterus and it makes the uterus contract. Now, that if you have high risk factors can be dangerous. Even nipple stimulation, avoid that because it can do exactly the same thing. So penetration is not the only thing I'm talking about. You have to avoid complete sexual stimulation so you will not have prostaglandins and will prevent any preterm contractions. Now, if it's an uncomplicated pregnancy, you had sex and you had a little bit of a cramping and even some spotting after sex, don't freak out. It's normal. What I just told you, that because of the orgasm or because of the prostaglandins in the semen, the uterus gets stimulated and you will have some cramping contraction, but that usually goes away in a short period of time. The bleeding is because there's an increased blood supply to the vagina and to the cervix, and it gets softer, it has got more blood flowing, and it can bleed. Now these signs will stop, so just lay down, hydrate yourself, and give it a little bit of a time. But the bleeding is like heavy, like a menstrual bleeding, or your cramping is so bad that you are like doubled over, those are not the right signs. That's the time you need to go and see your, go to the labor and delivery or emergency room and find out why it's happening, because this is not normal. Now during sex, remember, no vigorous sex, or no, don't use any toys or anything which will cause trauma, because again the vagina and cervix can bleed very easily during pregnancy. So as long as you follow those rules, and as long as your pregnancy is not complicated, you should be able to enjoy sex till you are in labor, or your membranes break, or you start leaking any fluid. So talk to your OBGYN, make sure your pregnancy is uncomplicated, and it's a very easy conversation. You should have it with your OBGYN sometimes early in pregnancy, so she or he can reassure you that it is okay. Now if you have any questions about what I said, or you have any other questions, please contact me. My email is hardasobgyn@gmail.com. My Instagram handle is GlamGyno, or just leave some comments below. If you like this video, please give me thumbs up as well. And I'll talk to you guys very soon. Goodbye.